Welcome everybody to Breaking the Cycle to Step Forward podcast. I'm Beverley Ann, and today I'm joined not just by one person, we're joined by a very special guest. So my co-host today is...
Hi everyone, it's Chris Tuck here. Hope you are all well.
And our very special guest is Dr Howard Schubiner. And Howard, would you like to tell everybody where you're actually speaking from today?
I am in the Detroit, Michigan area in the States, and that's where I've lived my whole life.
Fantastic. And we're recording at 3 o'clock in the afternoon, but it's about 10 o'clock in the morning for you, isn't it?
That's correct.
Thank you. Well, before we start our conversation today, I just want to do a little introduction about the background for yourself, Howard, and if there's anything you'd like to add, please do. So your official title is Professor Dr Howard Schubiner MD, FACB, the co-founder and clinical director and medical advisor of Freedom from Chronic Pain. You were a professor at Wayne State University for 18 years, and you're now at the Providence Hotel in Michigan, USA. And not only that, you've written several books, and we will be featuring these in the drop down for anybody listening to the podcast or watching the videos. So, but a couple of the books that you've written are Unlearn Your Pain and Unlearn Your Anxiety and Depression. But you're also co-founder for the PPDA, which is the Psychophysiologic Disorders Association.
Yeah, well, you make it sound like I'm very busy.
It sounds like it, because I have to say...
like you need a holiday.
I'm probably the only one here that's not written a book so far, because Chris, you've also written a book, haven't you?
Yeah, I have, yeah.
Yeah. So following on from there, we're going to start this conversation going. And I'm really interested to hear, because I know you through SERPA as a SERPA practitioner, and I'm also a chrysalis effect practitioner. So chronic pain, chronic fatigue, ME, fibromyalgia, and post-viral fatigue, I'm very familiar with. And Chris is familiar with the mind-body connection. But when you left school, I'm going to ask you, what was your first thought about what you wanted to do when you left school?
What do you mean? Well, I decided to be a doctor when I was in university. So I was around 19 years old, 20 years old at that time. Before that, I hadn't any thoughts about being a doctor. But, you know, like I think a lot of people, I wanted to help people and I wanted to be able to work in a community. And science classes came pretty easily to me, so it didn't seem that hard.
So when did you know that you were going to go more into the skeletal side of doctoring?
You mean the like the what I'm doing now, the mind-body medicine work?
Yes.
Yeah, I was interested in mind-body medicine back in the university days, actually, quite a bit. And I read a lot about it, and you know, that was very interesting to me. But then going to medical school and being a doctor and working at Wayne State University, as you mentioned, you know, I was mainly dealing with traditional diseases and learning how to be a doctor. And I did a variety of different areas of medicine, but around 21 years ago now, I read a book by Dr. Sarno, recommended to me by a friend, and that rekindled my interest in the mind-body connection. And that's when I started doing this practice that I've been doing now for the last 20 years of seeing people and trying to help them with conditions that most of the time modern medical practice doesn't really know how to address, like chronic pain, headaches, migraine, fibromyalgia, chronic fatigue, back pain, neck pain, pelvic pain, irritable bowel syndrome, anxiety, depression, insomnia. So there's just so many things. These are the main causes of disability in the world today. They're not the main causes of death. The main causes of death are still cancer and stroke and heart attack, diabetes, chronic lung disease. But these conditions that I mentioned are the ones that cause the highest level of people missing work, missing enjoyment in life, being debilitated, sometimes bedridden. And modern medicine doesn't really understand the power of the brain. It doesn't understand that our brains literally create what we experience. What we see is created by our brain. What we hear is literally created in our brain. And what we feel is literally created in our brain. And this is, modern neuroscience that, doctors haven't really been taught.
Absolutely. And Chris, I can see you've got something you'd like to say.
Yeah, I was just going to ask Dr. Schubiner, what do you actually mean for our listeners about the mind-body connection, and why is it that most GPs, medicine people, don't get that mind-body connection? What is it that makes them not get it or want to get it?
Yeah, well, they weren't told about it. And when people think about the mind-body connection, they think that when I say that our brains are creating what we experience, then people jump to the idea that you're saying my pain or my depression or my anxiety is all in my head. It's not real. It's imaginary. It's my fault. There's something wrong with me as a person. And none of that is true. But the reason I say that our brain creates all of our experiences is because that is true. When you touch a hot stove, it's not your finger causing pain. A finger can't cause pain. And that is a weird concept for people to get. And the reason we know that is because millions of people over years, this has been documented many times, have had injuries, and most people have had some experience with this, where you can have an injury and not have any pain, not even be aware of it, because your brain is occupied by something else. So the point is that pain is a decision that the brain makes on a minute-by-minute basis. That's number one. Number two, injuries can clearly activate parts of the brain that turn on pain. We know that. Everyone knows that. But what most doctors don't know is that stress and emotional situations activate the exact same parts of the brain as does a physical injury. So if someone has stress and an emotional injury, that can cause the brain to turn on headache or back pain or stomach pain or anxiety or depression or fatigue. And that seems like that is all in the body because you're feeling it in your body. But that's how the brain works. And so the reason the brain does that is it's trying to protect us. It's a danger alarm mechanism. And whether we evolved this way or whether God created us this way is a debate for another time. But the fact is that's how we are. So when you're endangered, either from a physical injury, that's endangerment, or from an emotional injury, that's endangerment, the brain has the capacity to activate a warning system, like a smoke alarm. And this warning system can consist, it doesn't tap you on the shoulder and say, my dear, there's a problem in your life, or you've got a nail in you've got a thorn in your side, or you've got a person who's, abusing you. It just gives you these symptoms as a warning. It's up to us to figure them out.
So I just want to clarify something again for our listeners as well, because we talk about mental illness, and depression often comes into mental illness. But personally, myself, when we're speaking about mental illness, I prefer to say neurological. And it's not an illness, it's a neurological response. So our amygdala is our alarm bell. And when we've experienced something that's so highly emotive, our brain is suppressing the emotions because trauma doesn't have a voice. And so that's where the pain comes from the body, because it's trying to keep us safe.
Right. It's a neurological condition, but you're right, it's not a disease. These are learned neural circuits. There are neural circuits that can turn on in the brain, and neural circuits are how we ride a bike, how we sign our name, how we walk, talk. And these neural circuits can be pain or anxiety or fatigue or depression. And they can turn on and they can turn off because they're neural circuits. They can become habitual. And that's what happens in people with chronic depression or anxiety or pain. And what happens is the habitualness comes because of a variety of factors, one of which can certainly be prior trauma that's unresolved, ongoing stress, ongoing emotions, ongoing trauma that's still happening and causing the brain to feel endangered, and how we treat the symptoms. So the symptoms are being treated by medical professionals who are telling us, oh, you've got this thing that's never going to go away. Yeah. You've got this disease of your brain. You can never fix it. You've got to take medications or ECT or, all sorts of things. And holistic doctors are saying you need supplements and you change your diet and all these things. And so those things cause a lot of fear. They cause people to be more and more afraid of the message of the alarm. When a smoke alarm goes off, we're not afraid of the sound. The sound is there to help us. It's an alarm. But when depression comes or pain comes, we start to get so afraid of that, and we miss the understanding and stepping back and thinking about it as a message, as a protection, not as the problem itself. But when we spend so much time trying to fix the problem, that actually can make it worse and can make it become more habitual, more chronic.
Because we're looking at the symptom and trying to treat the symptom, not what's the underlying cause.
Exactly.
Chris, I see you want to say something.
Yeah, that's exactly what I was going to say, Beverley, is that the medical profession are so keen to fix the symptom, but until we fix the cause, the symptoms are not going to go away. And there are many people out there who have gone through what we are on about, childhood abuse, and then have trauma from that. They experience that physical pain and they are not aware of the link, and they don't connect the dots, and they don't get the right help and support for themselves. They are in a continual cycle, a habitual cycle of just trying to address the symptom with some kind of medication that causes another issue, and then there's more medication, and they're on this wheel that they can't seem to get off until they get this bit of awareness of the brain-body connection. Do you agree with that or not?
Yeah, 100%. That's exactly what happens. And people have different names for it. The names are, each name is scarier than the last: resistant depression, treatment-resistant depression, PTSD, chronic PTSD, complex PTSD. Yeah. All these things that making people think they're worse and worse than they are. And I'm not minimizing the symptoms that people have. The symptoms are real. They're not imaginary. They're not all in people's heads. They're often debilitating. They can be, they can be obviously so scary and so fearful. And I'm not minimizing the trauma that people went under either. That's what I do every day. I see people who've had trauma and the stories that I've heard, are just shocking. Some of them are so shocking, what people have been through. But it's amazing that people can go forward. It's amazing that people can recover. And, it's thanks to the work of so many people and the work that you're doing.
Thank you. But also what I find fascinating, because I've heard you, I've read your books, I've heard you speaking before several times, is how you've trained in the biomedical world. You have this innate understanding of the mind-body connection, but then you started off with your spinal surgery. But the story that really is interesting is, after doing so many surgeries, what your results were until you started to change your ways of working and bringing in the mind-body connection.
So I don't do surgery. I'm not sure you're.
No, but working so with the surgeries that take place sometimes we opt for surgery before we look at any underlying cause.
Right. Yeah, I mean, that happens all the time. Sometimes, sometimes medical procedures help people, not because of the procedure, but because of the placebo effect. Mm. So there's a lot of surgeries, injections that are done that are, frankly, basically unnecessary, but they may work because it turns off the danger signal in the brain. Pills can work by the placebo effect. Antidepressants have been shown in many studies to have about 75% of people have a good response in 6 weeks. That's pretty strong. 75% have a good response. But if you look closely at the data, you see that 72% respond to the placebo.
Wow.
So that makes you wonder. And so that when you put all those studies together, and what happened with antidepressants is the pharmaceutical companies that are making the medications only published the studies that were positive, that showed that it was better than placebo. They didn't publish the studies that showed that the placebo was just as good as the medication. So people weren't aware of those, and the medications got approved. But when you look at all the studies, put them all together, and this was done by Irving Kirsch and colleagues, a friend of mine, they found that there was really little difference. And so when you have a disorder that has a very high risk, can have a very high response to a placebo, that tells you it's a mind-body disorder. And it tells you we can use, hopefully, if people can understand this, we can use the power of their own brain to help them recover. Use their own brain as the placebo, so to speak, by giving them information and caring and tools and hope and connection to others. A lot of people can get better without medication or invasive procedures, and that's the work that we've been doing.
Dr. Schubiner, in our experience of working with some victim survivors like a diagnosis because it almost gives them something to hold on to and something to have safety in and something to work with. Whereas others of us, we know we have the symptoms and we've dealt with them or not along our journey, but we don't like the labels because we don't want to be held back. How would you typically work with somebody who came to you with physical pain? How would you sort of speak to them, talk them round to actually explaining that your physical symptoms could be because of the mind-body connection? How would you actually do that when someone's really convinced that the only thing that would help them is medication or is a procedure?
Well, not everyone is convincible for anything. Mm-hmm. If you've ever tried to change someone's religious beliefs or political beliefs, you'll know that people come to things on their own for a reason. Mm-hmm. But people who are in pain or people who have depression or anxiety have a reason to change. They want to get better. They clearly want to get better. And so what we're doing is, the first step is love, basically. It's compassion, it's validation, it's listening to their story with compassion and understanding their story and helping them to look at their story from a slightly different lens. Because if you can help them see that when they started getting stomach pain when they were 8 was at a time when something was going on in their life that was making them feel unsafe. That's an interesting connection, right? When they were 14 or 15 and they started getting headaches or migraine, there was something else that was going on in their life that was making them feel unsafe. That's an interesting connection. When they were 23 and they started getting pelvic pain and irritable bowel syndrome. There was something that was going on in their life. And when they were 35, when they had that car accident, there was something that was going on in their life. And so if you can help them see the story in a different way, if the story is bad things happened to me, I was unlucky. And on top of that, all these other medical things happened to me that were unrelated. I'm really unlucky. So I'm doubly unlucky. And the doctors couldn't find a cure for these medical conditions. Therefore, I'm broken and hopeless. The hero of that story is the doctors. But if you change the story a little bit, tell people see that they were definitely unlucky in the things that happened to them. But those things that happened to them had consequences of leading to the headaches, the stomach pain, the depression, the fibromyalgia, the chronic fatigue. And the doctors couldn't help you because they didn't understand why you had these in the first place. But if you can understand why you have these, the hero of the story is now you. And you can change your viewpoint if you want. And it doesn't mean you're giving up the symptoms. The symptoms are real. You're not, those are validated. You're changing the label from maybe fibromyalgia and complex PTSD to mind-body condition. Neural circuits that have been learned and can be unlearned. That is a way more hopeful way of thinking about things than, being completely broken.
Very empowering, that different lens that you look through and explain things. Very empowering to healing.
Yeah.
And that for me, recovery, healing, by having hope and being able to feel that you understand more, I think is empowering for a lot of people. I know it certainly was in my own experience of healing and recovery. I don't know about you, Chris. We've both had lots of experience. We've lived experience, and we've both researched and studied to get to this point more. One of the things that's really interesting is the film that you're involved with, your This Might Hurt film. Would you like to talk a little bit more about your film and how it came about and how it started? Because that would be interesting for some of the listeners, especially now they've heard you talk. Now it's like, oh, let's go and have a look.
It's a great film. I mean, it's not my film. It was created by Kent Bassett and Marianne Cunningham. They're the directors and producers of the film. They spent years and years doing this on virtually no money, borrowing money, because they desperately wanted to make a film that would help people see and understand this mind-body connection in relationship to chronic painful conditions. And the film documents how, in the people in the film, it documents how their pain was related to traumatic events in their life. It is very clear, it is very powerful, and it's very healing, because when people can deal and address the emotions that have come out of the traumatic events in their lives and look at them instead of casting them aside and pushing them down and trying not to deal with it, but being open and being able to understand that, something happened, and that made me really angry. And I have that anger, and I can allow myself to express that anger in a safe and healthy way. I can allow myself to express the sadness and the hurt in safe and healthy ways. And I can turn the sadness and hurt into compassion for myself, and assertiveness for myself, and standing up for myself, and realizing that I can change the ways that I have reacted to things. Because when you're hurt and when you're young and powerless and being hurt or abused in some ways, you have to adapt to that, and you do the best you can. And so people learn how to not rock the boat and never speak up and never always put yourself last and be a perfectionist and try to be perfect and feeling guilty, like somehow you've done something wrong. And those ways of reacting are actually very adaptive to that time. It made sense. That's what people had to do. They had to learn how to teleport and be somewhere else, not in their body. But now they can, from a lens of safety, they can learn to change how they are. They can be in their body. They can be kind to themselves. They can learn to say, there's sometimes I call a magic word that people can use. It has 2 letters. The first letter is N and the second letter is O. And sometimes it's magical to be able to say, no, I can't do that. They're just little things, but when you put together the understanding that you're not broken, that the pain is due to the brain, and that you can stop fearing it so much and move on with your life, and you can address the trauma, and you can address the emotions, you can feel the emotions, allow them to come into your life and feel them and express them in safe and healthy ways and move through them to compassion. It's really a fantastic recipe for healing, and that's all in the film.
Yes, no, and I think it highlights it really well. So for anyone listening, this might hurt, and we will put the links, as I said earlier, for anyone watching or listening. That will all be included in there, which is very important. Chris, anything else that you want to ask?
Yeah, I just wanted to pick up on something and ask your expert advice on it. So when I worked in a psychiatric hospital as a business manager, but I later went on to work with the patients because it was part of my recovery. They would always deal just with the symptoms. They were never interested in what the cause was. And for me, no medical training, no psychiatric training, nothing. All I ever did was listen to the patients, and all I ever heard was a backstory of trauma. That's all I ever heard. And that's what sent me on my journey to delve a bit more into that mind-body connection and trauma and recovery. They still, when did I leave there? In 2012, they still only deal with the symptoms. How can we turn around or try and turn around the way that the main medical people deal with this, Dr. Schubiner? What will it take?
Well, maybe we can take everything that I just said about all that healing and everything and put it into a pill,
Yeah. We know that's not going to happen.
Okay, take this pill, and then we'll talk about, take this pill. This is a specially designed pill to help you talk about trauma. Yeah. Take the pill, and we'll talk about trauma together,
And that's where we're very,
maybe that would do it.
But that's where we're very passionate about having conversations, because what we're looking to do is give a voice to trauma, because obviously our brain shuts down at the most traumatic time and there is no language, and that's when our emotions neurologically have to go somewhere in the body, and that's why they're so closely connected with pain. And even by having this conversation, for anyone listening, and you want to find out more, there's so much information. So film is information, we give information in this podcast. I'll be putting a link as well for Dr. Howard Schubiner, because he's got a list of podcasts. You've been a guest with very many people, including Dr. Chatterjee as well, which is fantastic. One of the things I wanted to come back to was about prescribing, and I'm currently studying myself again because it's something we continually do anyway. And I'm studying with the Open University. And when I was accessing something last week, I came across some figures, and these come from our own National Health Service, from their website, excuse me. And between 2014 and 2019, so 5-year span in the UK, there was nearly a 31% increase in prescribing antidepressants. And when I say nearly, it was 30.9% increase. So that's how specific it is. And what's quite shocking as well is the average age is becoming lower and lower.
Right. Yeah.
So what thoughts do you have on that?
Well, the doctors only have the tools that they have.
Yeah.
And so more and more doctors are using, they're seeing this. There's been a dramatic rise in anxiety and depression in the societies, and particularly in young people.
Yeah.
There's been dramatic rises in anxiety and depression. This is even pre-COVID. It's worse since COVID.
Yeah.
And a lot of that has to do with isolation, social media on young people, and just the whole society being more and more polarized. And all of that, affects people. People are affected by their surroundings. There's more and more economic instability, and so young people they're like the canaries in the coal mine of our society.
Yeah.
And leading on from that, Bev, is also, Dr. Schubiner, to suppress our pain or to deal with our pain. We often do, most of us, look towards something that's going to help with that. So it could be food, it could be exercise, it could be sex, it could be medication, it could, whatever it is, to help us deal with our pain. And often in the work that I've done with survivors, if they try and give up their addiction to whatever, it might be smoking, for example, or it could be, cutting down on the unhealthy food and trying to eat a bit more nutritionally optimal, then another addiction comes in. How would you sort of like deal with that, or give some advice to people on how to try not to trade in one addiction for another, and in order to heal the best way that they can? Do you come across that in your practice?
Yeah, well, a lot of times this happens frequently, and the underlying mechanism, it seems to me, is fear. So if there's a deep underlying fear of, fear of being yourself, fear of who you are, fear of your past, then you're going to find some escape from that. And the escape can be addictions or pain or anxiety or whatever, and they can shift from one to the other. But if that's why addressing the underlying trauma, that's why addressing the underlying fear, and seeing if you can see where this fear comes from. One of the trauma treatments that Mark Lumley and I developed is called emotional awareness and expression therapy, and you'll see that in the film This Might Hurt. And we've written about it, and we've done research on it, showing that can be very effective by helping people do what's called memory reconsolidation, which is going back in time in a fantasy not to relive traumatic events, because that would be cruel. To relive them would be horrible, but to change them, to go back in time to help that younger person who was you, so that they can change the story in an imaginary way to free themselves, to protect themselves. And that can have dramatic effects on lowering the fear that they have. And if you can actually lower the underlying fear, then they won't need the coping mechanisms as much.
Yeah, that's something very powerful, and something that I do often with my clients. So we don't go back to the actual trauma and take it apart, because that's revisiting the trauma, but we're able to go back and even speak with our younger self, or write to our younger self, right. And what would your younger self want at this moment?
Right.
So you're working with a lot of trauma, and vicarious trauma is something that we all have to be aware of when we're practicing. So I'm going to ask you something completely random about self-care. What do you enjoy doing yourself for self-care for yourself, and putting some fun into your life, and letting go of some of the trauma, because that's important too?
Yeah, I love to golf, and I really like to to exercise. So I've been taking all these classes. In the States, we have the YMCA, and I joined a local YMCA, and I'm taking all these classes now, and spinning and body pump, lifting weights. But the one that I took for the very first time the other day was Zumba class.
I used to teach that, Dr. Schubiner.
Really? And I thought I would never do that. It seemed like it was mainly for women, that I shouldn't be doing that. We did the class, and after, it was so hard. I mean, it was so strenuous.
Yeah.
And I said to the teacher, I thought this was going to be cha-cha and salsa. And I said, it's more like high intensity exercise. And she said, thank you.
I have to say, I'm not a Zumba person. I tried it, but I'm not used to dancing in trainers. I like dancing in heels with a drink as well. So what does that say about me?
Well, everyone has different things, but it's
I enjoy
important.
The golf.
Self-care is important. Yeah,
absolutely. And that's something we live by. And I'm actually playing golf tomorrow for the first time this year.
Oh, wow.
So yeah, looking forward to it.
Yeah.
So, well, it's been an absolute pleasure. And I have to say, when we asked you to be a guest, I was like in awe when you said yes. So a big thank you from myself. And what we do our last thoughts before we finish. So if I could go to Chris first of all, and Chris, any thoughts before we finish today on this podcast?
No, I just think it's magical that we can talk to someone across the pond, so to speak, and get more resources for our listeners, and just spread the word more, that people can empower themselves to heal. They don't have to stay stuck. They don't have to stay in pain. They can be more aware and go and get help and support to live their lives to the full. So I just think that's just magical.
Absolutely. Thank you, Chris. And Howard, what would your last thoughts be joining us today?
Just that there's hope. Please don't give up hope. Please move towards compassion. Please move toward caring and connecting and living with meaning and purpose. There's lots of resources out there, and you have a lot of them that you can help people with.
Thank you. And my last thought is, I always admire how our bodies work hard to keep us safe. And sometimes they use the physical way to try and warn us. So it's that fear is often embedded at one time, but it's realizing that there are options, there are choices. And when we're ready, it's not about just diving in and opening it all up like a can of worms. It's about having the knowledge, knowing that there's choice, and there is always hope for recovery. And as we say, breaking the cycle to step forward from abuse. Yeah. So thank you very much for today. We're going to say goodbye to everybody, but please stay with us, Howard, because I'm going to stop the recording in a minute. So goodbye, everybody who's watching.
Bye-bye. Thank you.
Bye, everyone.